Hi, this video is about the vena cava and azygos venous drainage of the body. The caval and azygos system of veins is a network of veins that drain organs in the head, the neck, the thorax, the abdomen, and even the pelvis. It consists principally of the superior vena cava, the inferior vena cava, and the azygos vein. The superior vena cava and the inferior vena cava return deoxygenated blood from systemic circulation to the right atrium of the heart. The superior vena cava, as the name implies, is located superiorly and therefore is joined by veins that drain the head, the neck, the upper extremities, and the thorax. So it basically receives venous return from organs above the diaphragm. It is quite short compared to the inferior vena cava, and it measures about 24 millimeters in diameter. The superior vena cava is located in the anterior right superior mediastinum. It is the typical site of central venous access via the central venous catheter or a peripherally inserted central catheter. It is formed by the left and right brachiocephalic veins, also referred to as the innominate veins, which also receive blood from the upper limbs, the eyes, and the neck. It passes vertically downwards behind the first intercostal space and receives the Azygos vein. After receiving the Azygos veins, it pierces the fibrous pericardium and then connects with the sinus venarum of the right atrium of the heart. The internal jugular vein is a paired vein that collects blood from the brain, the superficial part of the face, and the neck. In the neck, the internal jugular vein drains the superior and the middle thyroid veins before joining the right and the left subclavian veins. The inferior thyroid veins drain directly into the brachiocephalic veins. The external jugular vein is also paired. It receives the greater part of blood from the exterior of the cranium and the deep parts of the face. Now the subclavian vein is a paired large vein, one on each side of the body. Their diameter is approximately that of the smallest finger. Each subclavian vein is a continuation of the axillary vein and runs from the outer border of the first rib to the medial border of the anterior scalene muscle. From here, it joins with the internal jugular vein to form the brachiocephalic vein, also known as the innominate vein. The angle where they join is called the venous angle, and this is at the level of the sternoclavicular joint. The left brachiocephalic vein is usually longer than the right brachiocephalic vein. Now these great vessels merge to form the superior vena cava. So as we can see, the brachiocephalic veins are the major veins returning blood to the superior vena cava. So as we said earlier on, the inferior thyroid veins drain directly into the brachiocephalic vein, together with the left and the right internal thoracic vein, as well as the left superior intercostal vein. The beginning of the superior vena cava is at the level of the aortic arch. The azygos vein ascends on the side of the thoracic vertebral column, draining itself towards the superior vena cava. It connects the systems of superior vena cava and the inferior vena cava and can provide an alternative path for blood flow to the right atrium when either of the vena cava is blocked. The azygos vein transports deoxygenated blood from the posterior walls of the thorax and abdomen into the superior vena cava. It is formed by the union of the ascending lumbar veins with the right subcostal veins. From there, it ascends in the posterior mediastinum and passes over the right main bronchus posteriorly at the root of the right lung in order to join the superior vena cava. The hemiazygos vein and the accessory hemiazygos vein, when taken together, essentially serve as the left-sided equivalent of the azygos vein. That is, the azygos vein serves to drain most of the posterior intercostal veins on the right side of the body, and the hemiazygos vein, together with the accessory hemiazygos, drain most of the posterior intercostal veins on the left side of the body. Specifically, the hemiazygos vein mirrors the bottom part of the azygos vein. Now, the structure of the hemiazygos vein is often variable. It usually begins in the left ascending lumbar vein or the renal vein and then passes upward through the left cruise of the diaphragm to enter the thorax. The inferior vena cava carries blood from the lower half of the body. It is a large retroperitoneal vein that lies posterior to the abdominal cavity and runs along the right side of the vertebral column. It enters the right atrium at the lower right backside of the heart. The inferior vena cava is formed by the joining of the left and right common iliac veins and brings collected blood into the right atrium of the heart. It also joins with the azygos vein, which runs on the right side of the vertebral column. Now, the point where the left and right common iliac veins behind the abdomen unite is where the inferior vena cava begins, and this is usually at the level of the fifth lumbar vertebra. It passes through the thoracic diaphragm at the caval opening of the level of T8 or the 8th thoracic vertebra. Because the inferior vena cava is located to the right of the midline, drainage of the tributaries is not always symmetrical. On the right side, the gonadal veins, that is the testicular and the ovarian veins, drain into the inferior vena cava directly. On the left side, they drain into the renal vein, which in turn drains into the inferior vena cava. By contrast, all the lumbar veins and the hepatic veins usually drain directly into the inferior vena cava. The femoral veins empties into the external iliac veins, which joins the internal iliac veins to form the common iliac veins. Thanks for watching. Please like this video and subscribe to the channel. More videos coming up. See you in the next one.